In this video, I'm going to be doing Invisalign open bite closure on one of my YouTube followers. Yes, you heard that correctly. One of my YouTube followers came to my office, completed their Invisalign treatment for open bite that they saw on this very YouTube channel. And here we are. Now that patient is on the YouTube channel. It's a great story. I'm excited to show you guys what I did for this patient. So here we go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about Invisalign open bite closure for this 30-year-old female patient. We are seeing a 3 to 5 millimeter open bite in the anterior caused by thumb sucking until the age of 16. Of course, we don't want our kids sucking their thumbs that late, and the result of thumb sucking is the open bite because the teeth cannot erupt into their normal position. And so that does not close usually. Once the tongue gets in that position, then you get the tongue thrusting. In order to fix that, of course, you got to close it orthodontically. And the previous orthodontist that she saw for a consultation recommended jaw surgery. She didn't want to do jaw surgery. Of course, I don't want to do jaw surgery or extractions. And Invisalign open bite closure is a newer method to fix this. She found this YouTube video or a previous YouTube video of mine, and she came and saw me, and I'm going to show you the results in just a minute. So let's talk a little bit more about open bites. So why do open bites occur in the first place? Oftentimes it's from a pacifier or thumb sucking where the teeth can't erupt into their normal position. They get stopped and then the tongue fills in that area, and that's called tongue thrusting. Also, another reason is enlarged adenoids and tonsils that occlude the breathing area, and therefore you get mouth breathing. When you get mouth breathing, you get a low tongue position, and then the maxilla constricts, and that can also cause an open bite. The result is usually tongue thrusting, speech issues, eating issues, lots of lisping of the words like S's and T's. And then the treatment for this is historically been extraction of teeth or jaw surgery. But more recently, in the last decade, we've been doing Invisalign open bite closure successfully without needing any of those extractions. Let's do a quick recap of the other Invisalign open bite closures that I've shown you. We have a 6 millimeter anterior open bite closure in a 53-year-old. We have a lateral open bite closure in a 22-year-old. This is one from the open bite on the side. We have a complete open bite caused by constriction of the arches, so the arches no longer fit together. This sometimes happens later on in life, like 50s, 60s, and 70s. We also have a 8-year-old for an open bite closure in the anterior. We definitely want to close the open bites as soon as they happen. And then we also have a teenager with an anterior open bite of just about 3 millimeters here. And now we're back to the Invisalign open bite that I'm showing you in this video. So our goals for this patient are to extrude the upper anterior teeth. So when we look at the smile, what we're seeing is we're seeing a negative smile arc. And so therefore there's a lot of empty space on the upper, and we want those teeth to come down. So in this specific instance, we are not extruding the lower teeth. We're going to be extruding the upper teeth. Let me show you how we did it right now. Here's the Invisalign simulation, and you are seeing the extrusion of the upper anterior teeth. This is exactly what we wanted for this patient's smile line. We did not want to extrude the lower teeth because that wouldn't get the ideal smile. So in addition to closing the open bite, we also have to look at the smile, how the smile is going to look when we're all finished, because that's ultimately the goal for these patients, is to get a great smile that's functional and looks beautiful. And I think we achieved that for her. Let's do a treatment recap for this Invisalign open bite closure. We can see that the 3 to 5 millimeter anterior open bite is closed with extrusion of the upper anterior teeth. By extruding the upper anterior teeth, we are seeing a much better smile. We don't have that negative smile arc. We have a very nice smile arc. Smile looks beautiful. We had overlapping of the front 2 teeth. We backed that up with a permanent upper retainer wire between the front 2 teeth because those teeth are not as stable. And then we're gonna do an Invisalign clear retainer. That's my retention option of choice, is Invisalign clear retainers, because the clear retainers hold that open bite close much better than the traditional retainers. Fantastic result. This patient is thrilled with it. She absolutely loves it. She loved not getting jaw surgery, and it was a great experience for both of us, actually. And I'm thrilled with her. And hello out there to my YouTube family. Thank you guys for watching this Invisalign open bite closure video number 6. I'm going to put it right here at the bottom of this playlist. I do a lot of Invisalign open bite closures. You can see open bite closure is one of my specialties. So if someone's out there and you're an YouTube follower and you have an open bite, I can definitely help you, or at least steer you in the right direction of where to go. Thank you guys for liking this video, commenting, and subscribing, and I'll see you on the next one.